Hi, my name is Allison Nunez, and my speech is why physician-assisted suicide should be legalized. The purpose of the speech is to persuade my peers that physician-assisted suicide should be legalized. Have you ever had to watch a loved one suffer from years from a disease or impairment without any signs of improvement? Now imagine if your loved one has a health condition that only deteriorates. Although it's a hard decision, physician-assisted suicide is one way that the individual can choose to end their misery and give their family a peace of mind. At some point in your life, each one of you is going to have some sort of encounter with someone who is suffering, and that person might even be you. Either way, sometimes the option of physician-assisted suicide is the most beneficial for helping the patient. In the book, Ethical Issues in Death and Dying, authors Bucamp and Perlin state that over 70% of Americans today die in a hospital or other care facility, which typically isn't the way people want to die. I was young when my grandfather was diagnosed with Parkinson's disease and died. But for the last year of his life, my grandfather was in immense pain and was unable to do the things that he loved to do. My father and his siblings tried their best to find a plan that could help get my grandfather back to his regular life, but ultimately there was nothing they could do to help his pain or to get him back to the things he loved. Although they let him die naturally, my father thinks that physician-assisted suicide might have been a better option due to the low quality of life and the pain my grandfather was in at the end of his life. It would have allowed my grandfather to die peacefully and painlessly, surrounded by his loved ones. Legalizing physician-assisted suicide would allow patients who are suffering to have the choice of whether or not they want to continue fighting for their life or if they'd like to die peacefully. Many people suffer from diseases and illnesses that make their quality of life poor. By allowing the individual to choose physician-assisted suicide, you're potentially relieving these patients from their suffering. If physician-assisted suicide is legalized, the individual can painlessly and quickly be put out of their misery. Let's begin by discussing the importance of legalizing physician-assisted suicide. Various diseases or health conditions can negatively impact the patient's life and induce a poor quality of life. The emotional and physical pains associated with these health conditions can affect the patient and their loved ones. Doctors and other healthcare professionals take an oath to never harm their patients, and while legalizing physician-assisted suicide may seem counterintuitive, it might be the best patient for some options, especially if the alternative is having a long and painful death. Some people would rather die soon than be left to the mercy of the doctor and other machines, according to Bucamp and Veach in the second edition of the book Ethical Issues in Death and Dying. Legalization would allow patients to regain control of their own healthcare options. Physician-assisted suicide has been legalized in some places, but the majority of the world it is not. According to a study done by Maurice Steinberg and Stuart Younger, what opponents see as the betrayal of traditional mission of medicine, many people see as a logical extension of compassionate care of the dying. Another common fear is that if it were to be legalized, patients may abuse the right. Now that we have addressed why there is a need for legalization, I will discuss how legalizing physician-assisted suicide can ultimately benefit the patients. Legalizing physician-assisted suicide allows the patient to have the choice as to whether or not they want to continue with their care, or if they want to choose a quick and painless death. It has been found that a majority of the patients who have chosen physician-assisted suicide did so because of the desire to control the circumstances of which they die, the wish to die at home, the loss of independence or the fear of this loss, and the loss of dignity or the fear of this loss, as reported by Angela Morrow, a registered nurse in Austin. Some fear that patients may abuse this right, but a study done in the Netherlands by Steinberg and Younger shows that even though many people have an interest in physician-assisted suicide, only a small proportion actually exercise this right. As a precaution to ensure that only those who really want to go ahead with this do it, it is often suggested that someone who wants physician-assisted suicide should expressly request such a procedure in writing with appropriate precautions, such as the presence of a witness and a waiting period to allow them to change their mind, as stated in the book Euthanasia and Physician-Assisted Suicide. This will ensure that the patient's best interest is in mind. Next, let's talk about how legalizing physician-assisted suicide could be beneficial to everyone. If physician-assisted suicide is legalized, or is illegal, then the patients will continue to have little to no say about their health care options. By legalizing it, it would allow the patient to die how they want to die, and it would provide them and their family with a sense of relief, knowing that their loved one is not going to die a long and painful death. Everyone should advocate and vote for legalization of physician-assisted suicide because it could have an impact on you and your loved one's life someday. In a New York Times article, Lou Spinley talks about how his son at age 24 had a catastrophic brain injury. His son begged him to let him die, but because it was illegal in the state that he was in, he had to watch his son die a long and painful death. Although it may not be ideal or the right option for everyone, physician-assisted suicide can help patients who are in extreme pain and have severe conditions with no chances of returning to health. Keeping an open mind about the matter, regardless of personal beliefs or religion, can help to legalize physician-assisted suicide and allow the patients who really need it to utilize it. In conclusion, there are many reasons why physician-assisted suicide should be legalized. Individuals have terminal illnesses, incurable diseases, and other severe health conditions that are prohibited from living their normal lives may benefit from physician-assisted suicide. Physician-assisted suicide provides patients with an option that, if chosen, can take their pain away. Keeping an open mind, advocating, and voting can help legalize physician-assisted suicide in all the ways that can help allow patients to make their own choices regarding their own health care options. Physician-assisted suicide would allow the patient to have the freedom to make their own choices regarding their health. Forcing the patient to live in agonizing pain with a poor quality of life and no hope of recovery is just inhumane. Why not provide patients with an option that, when all other options fail, could help them relieve their pain?